Welcome to the Long Story Longer podcast.
I'm Dominic Marano. I prescribe meds.
And I'm Katie Brzozowski, and I provide psychotherapy.
Long Story Longer is a podcast about mental health and navigating medication, therapy, and whatever else we want to talk about.
We will discuss topics from each of our perspectives. We will try to keep it to 15 minutes.
But it will probably be longer. Hello and welcome to the Long Story Longer podcast. My name is Dominic Marano. I am a family and psychiatric mental health nurse practitioner. I own my own psychiatric practice and I have a doctorate in the nursing practice. I've been in healthcare for over 20 years and more recently into mental health.
Hey, I'm Katie Brzozowski and I'm a licensed clinical social worker and I have a doctorate in clinical social work and I own a private practice and I've been in the mental health profession for over 25 years.
So one of the reasons we wanted to start this podcast, we actually work together with patients or clients, and we noticed that there's a gap between psychotherapy providers and medication providers. So we thought, hey, let's look at things from both of our perspectives.
As well as a gap in what people understand about both of those.
Exactly. Yeah, I think a lot of people come to me and they're like, oh, I want psychotherapy. And I'm like, well, I don't really do that. It's not to say I can't, but I just don't because that's not part of my business model.
But I can't prescribe.
Yeah. So people may come to you thinking different things. You tossed around the idea first and we're like, hey, we should do a podcast. And I had thought about doing one almost as a marketing thing, but I really think that there may be some utility to have the both of us talk together about different topics and see what works. And hopefully it gives people insights as to where they should be going if they have needs for either medication or psychotherapy. My big thing is I think in mental health, I sort it out in a way that there's neurobiochemistry that involves your neurotransmitters, and that's where medication really, really helps. That there's the past, that's like the behaviors that you've had, any coping skills or lack of coping skills that you've developed, and any trauma or anything that really influences the present. And then lastly, just whatever situations are going on. Sometimes in life there are things that happen, medication or psychotherapy in that time is useful. It's kind of like a transient sort of thing.
I think that's a great way to conceptualize it. I also think when I work with clients that there's basically a why and a how. So when I'm working with someone, I will think, okay, well, we have to get to the why because if you have a weed, right, and you mow the lawn, the weed's going to go away. But if you don't rip it out from the root, it's coming right back. So we want the why. Why is this happening, or are you like this, or whatever it is? But then we need the how also, because if your therapist spends too much time on the why, you're still going to go home being worried or showing up late to work or whatever it is, and then that's not fixed. But if we only worry about the how do we fix this thing right now, and we don't do the why, then like the root, it's going to come back up. So
yeah. So and I think that's just goes to show that taking different perspectives and looking at different areas of that's why it's nice for both of our worlds to meet. Another reason why both of our worlds meet is the Long Story Longer podcast and how it got its name. We have focus-related issues and
read ADHD.
Yeah. So
and Dom always says long story longer.
Yeah. Because I can't tell a story, keep it straight and concise to save my life. So we're going to try and do that. And I think you help me do that and I help you do that. So that's kind of where our partnership is, even professionally, but also in the podcast, we'll try and rope one another into the best of our ability. Our goal is to try to keep things around 15 minutes because we figured that's how long a podcast should or could be, or it might be, longer than that. Some people feel it's a commitment, but sometimes you only take like little short drives.
Yeah, it's just listening to it a little bit whenever you get the chance.
Yeah. So our first topic we wanted to go into, because it's so relevant to us, is Attention Deficit Hyperactivity Disorder. I like to start off with a little background about it. So it's estimated that 6 to 9% of the pediatric population are diagnosed with ADHD, and about 4 to 5% of adults have ADHD. And this information was from the CDC. It's just such an interesting diagnosis, and I think we were talking about that everyone thinks they have it.
Yes. And some people do have it, and then it's good that they think they have it, and they get diagnosed and can get treated. But even with treatment, it's still a lifelong issue. I mean, we both have it. I was diagnosed many, many years ago, and I've been treated for decades, but it still is an everyday situation to manage stuff, to not lose stuff, to be on time, to not say too many words. And then there's issues around that, which is self-esteem or feelings of failure, or why can't I do this thing when everybody else, it's easy for them. So TikTok is great. So is all the social media, and they've given us so much information about what ADHD is and all these symptoms, but there's a lot of things that overlap. Life is stressful. You may be forgetful. You may not be able to pay attention, but attention spans are just shorter now anyway, because we aren't bored. We have phones. I mean, when we were growing up, like, the DMV was the most boring place in the world because you had to just stand there and do nothing. There's nothing to do. Maybe you bring a magazine, but that's it. There's nothing to do. And so you're always bored. And I mean, I grew up in the 70s and 80s. You grew up
the 80s and 90s.
And it was very different. But I know for me, because I was a girl in the 80s and 90s and gifted but straight C student, pretty much. Never turned in homework, losing stuff, spacing out, and always got the comment, didn't live up to her
potential,
right?
Yeah.
Doesn't apply herself. That was like constantly. I was applying, I was trying, but and I wish that I had been diagnosed in high school or earlier, but I wasn't, and most women weren't, which is why women now, a lot of middle-aged women like myself, are getting diagnosed now, which I think is great. But also, maybe you have it, or maybe it's a combination of a bunch of other things. Either way, we wanted to bring this up today just to look at it from both of our lenses. What exactly is ADHD? And then also what medications treat it? And then what would we do in therapy for that?
Yeah, I wanted to reiterate what you just said, that with mental health diagnoses, there's so much overlap. So for instance, like depression, lack of focus, anxiety, lack of focus, and restlessness, even restlessness and depression too. I don't test for ADHD. I refer out for it. It is long testing. So there's different components in the DSM-5 that you have to qualify.
People will say I have ADD, or they'll say I have ADHD. There's actually no ADD anymore. Now it's only ADHD, but that doesn't mean that you have to have hyperactivity. Exactly. ADHD is the umbrella, right? And then you have the three different types. So you have the inattentive type, and then you have the other type, which is hyperactive / impulsive.
Yes.
And then combined type.
Which F90.2. That's what yeah. So I remember that. And typically I find that there's people, and this is just anecdotal, it's not a statistic or anything, people who have had a combined presentation, either outgrow it or they keep it. And it's when they know that they have a diagnosis of ADHD, particularly later on in life, it just makes so much sense. I have people who were like, yeah, I was robbed of my childhood because they didn't diagnose. Yeah. And particularly with girls, people automatically assume, well, there's a boy, he has ADHD.
Because he's running around breaking stuff. So
yeah.
Like,
and yeah, I mean, it's funny too when you see in practice, I have some textbook people where it's just like, wow, look how hyper they are. Inattentive and impulsive they are right now. And this isn't telehealth. You can just see them like about to explode, that this is not entertaining. And I'm like, I get it. But yeah, so in terms of medication, and again, these are not formal recommendations. We are not recommending any specific therapy or any specific medication. This is just kind of how we do it. We base a lot of our stuff off of evidence-based practice, but still, no formal recommendations.
Yes. So meds.
So to start, I just divide them into two categories, stimulants and non-stimulants. Your stimulants consist of instant release or extended release, and these are your amphetamines or mixed amphetamine salts and methylphenidate. Common names for them are Ritalin or Adderall. Those sort of medications consist of various preparations of that. So basically, one is short-acting, one is long-acting. They have various times in which they work. And the way that I prescribe is I'll save my stimulant unless I know someone has gone down the non-stimulant route first, and then I will try to do an extended release one first. So the non-stimulants are, there's a medication called atomoxetine. It's kind of similar to Wellbutrin in nature. We also will use Wellbutrin or bupropion.
Strattera, is that a non-stimulant?
Strattera is a non-stimulant. Yeah, so it works on dopamine and norepinephrine pathways. It's part of the antidepressant family, but was FDA approved for ADHD. So other medications, and they're called atypicals, the atomoxetine or the Wellbutrin or bupropion. Next up is the alpha-2 agonist. These are medications like guanfacine or clonidine. Serotonin norepinephrine reuptake inhibitor. There's a medication called viloxazine. So that's was marketed for ADHD as well. Again, all of these work on various neurotransmitters. The stimulants work predominantly on dopamine pathways. And then with the stimulants, I always like to check with people in terms of when their intake, if they have any cardiac history or anyone in the family does. Ideally, you get a baseline EKG. Not everyone does that, and particularly in young people, it's not necessarily recommended, but we try. And that's also a challenge with telehealth because then you have to mail them a script if you can't order it through eScribe. But anyway, just with those medications, it's stimulant versus non-stimulant. Again, just anecdotally, my pathway is to try a non-stimulant first. What I also like to do is, and I think we talked about that with the overlap, a lot of times within the testing that I send out, it will say make sure anxiety and depression are treated first. And if the focus issue still remains, then consider a stimulant or non-stimulant treatment.
My understanding is that the reason stimulants work is because they basically act the opposite in an ADHD brain.
Sure.
So if you were drinking a cup of coffee and you didn't have ADHD, you would now be alert or hyper. But if you were drinking that and you do have ADHD, it will have a different effect.
Yeah, I mean, that's
right.
It's
Conceptualization.
I think for the most part it is. I think that is it like tried and true in exact science? Not exactly, but it is. I mean, I've seen it in patients too, where they were like, I took a stimulant and I was wired and anxious. Well, that's not for you.
Yes.
Yeah, and sometimes if someone does have a co-occurring anxiety, the anxiety supersedes the focus and they're like, I just can't take it anymore. But I do agree. I think that there are people who, particularly you see it a lot in adolescent populations. I even have friends who had a kid who was put on a stimulant and he would be someone who was running around, whatever, but now he has the ability to focus and to do really more in-depth cognitive stuff. Grades got better. It's kind of get art more than a science, as we like to say.
Do you ever have anyone tell you like, well, I don't want to take ADHD meds? You certainly don't have to, but there are some times, and you can have mild, moderate, or
sure, yeah,
severe.
It's a spectrum. Yeah.
So you may have ADHD, but it might not be very severe. And maybe if it is, though, maybe medication is important in order to make any behavioral changes, because it's not necessarily a mind over matter thing if you really need a medication on board.
Yeah, I kind of look at that from the neurobiochemistry of it. If we're able to intervene in that measure, then yeah. And I think that, gosh, see, this is the problem with focus. You just lose it and then it doesn't.
Right in the middle of talking. I'll be talking and then it'll just go away.
It just falls out. Thank God we can edit all this. But I think just lastly, and getting with that, we talked about a spectrum. We talked about people with various medications and having a diagnosis. I will push someone to go on medication if it interferes with their ability to function. If you focus and you can't focus or are impulsive and, it's impacting you keeping a job, it's impacting you to balance your bills, basic things of life that we have to get done. Some people's with ADHD, I don't think any mental health diagnosis defines anyone, but certainly people with any mental health diagnosis, if it impairs their ability to function and live and quality of life situations, I think sometimes either a behavioral intervention or psychotherapy or medication or a combination of both.
I think if we think about how ADHD actually does manifest itself in our lives, that's the important part. So whether you have ADHD or not, because some people are like, I have it or I don't have it or I'm not tested or I am tested. I think it's basically, is your inattention or is impulsivity or is hyperactivity, are those things impacting your life? As you said, there's a lot of great people out there talking about this, way, way better than me about this, and talking about how it affects their lives in so many different ways. And once you realize that you have ADHD or you're diagnosed with ADHD, and I think that's what TikTok is doing, is saying like, what about this? And what about this? And people are like, oh my gosh, you mean,
it's almost like a make it make sense moment where you're like, the light bulb goes on and then you're like, I lose all of my stuff all the time.
Rick Green is awesome. And he used to have this unofficial ADHD quiz, right? And I had already been working with people with ADHD in a clinical setting. I had been diagnosed many years before. I'd been treated for many years with it. And when I saw that, I was like, holy cow, it was so many new things that I had not thought of. One of my favorite ones was he said, is your whole kitchen a mess because you made one bowl of cereal? And I was like, that is exactly right. And then every time you lose a shoe or a thing, and the ADHD tax, that is so real, because the amount of money that I have spent on forgetting to pay a ticket or my registration being late, and then it affects people's self-esteem because then they think like, I'm not an adult. I've had so many people say like, I'm acting like a kid. I'm not an adult. You are an adult. You just have a difference.
Yeah, and I think it's kind of recognizing that. I love the aha moment that people have because you kind of give yourself permission to be a little flawed. You're not the same as other people, but now having a causative thing, that's a place where you can intervene. I have someone like, oh, I lose all my things. Well, do you put them in the same place every time? So behavioral interventions like that, or
setting timers.
Setting timers, yeah. Even scheduling to do things. Having self-awareness when you're getting a little too like, wow, I'm getting wound up. I think you and I kind of have this thing where when we get excited about an idea, we start to avalanche. And it's like, oh, wait, we got to pump the brakes because we've now just spent thousands of dollars to make something happen when we could have done it much more simplistically. And really, like you said, like the lived experience of like, how do I intervene with that? And do you find that there are any particular therapies or behavioral modifications or behavioral interventions, I should say, that make a difference in people's lives that from what you've seen?
Oh, for sure. I mean, and there are tons of them, and there are lots of experts out there. You hear the joke about the person with ADHD buying a new planner like every 2 weeks because this is the planner that is finally going to organize my life. And so, sure, there are some planners that we will stick with. And I think what I like to do is I really try to take a strengths-based focus with every client I have. And so people with ADHD are good at stuff.
Sure.
There are things that they are able to master. And so like one of the things is like they recommend habit stacking, right? So if you already have a habit, like let's say every morning you get up and you go take a shower, right? Mm-hmm. Well, if your goal was to make sure you brush your teeth more regularly or make sure you do something else, just stack that habit on the thing you're already doing. Yeah. Like, so those types of interventions I think can be helpful, but we all already do something, right? Like ever since I was a little kid, I pick my clothes out the night before. Always. My earrings, everything, my shoes, my undergarments. And that's probably one of the only organized things I do, but it is helpful because then in the morning, I'm only a half hour late instead of 45 minutes late because of that. But that you can take that strength and then you know that I have that capacity. Yeah. So then you can work on that in other areas.
And you have to think about it too, like just incorporating the way I separate things in my brain. And I think I actually did this to try to organize my thoughts. But with mental health is the past and behaviors that you do. I think some of the behaviors in ADHD are actually learned behaviors that you do. Like, for instance, tossing the keys. Just tossing the keys. That's a repetitive behavior that you do. You purposely have to do that. I don't, even walking in here today, I carried my keys. I put them down wherever I put my first piece of shit down, wherever it went. Whatever I put down, that's where my keys land. And I've been really trying within the past year, at least at the end of the night, if I see them, to hang them on the rack, because I'm terrified of getting stranded somewhere. So sometimes fear plays into that. It's hard to weed out which is like true anxiety versus ADHD anxiety. Yes. It really is hard with that overlap. And even though we said diagnoses can overlap, like pulling that apart. And I try to do it in a place of where, all right, do you have anxiety when you're just sitting there at night doing absolutely nothing? And they'll say yes. And I'll be like, well, why do you have that? They'll be like, because of all the things I forgot to do during the course of the day. So what if you could remember them? Would that anxiety go away? Well, yeah, well, maybe that might be ADHD that's causing that. Or if it's like, I'm afraid a cat's going to attack me. Okay, well then that's a little bit more anxiety-based from a phobia base versus having ADHD. It's not easy. And again, I said there's no cookie-cutter diagnosis that everyone perfectly fits into. My thing is always going to tell everyone, diagnoses are important. They kind of help us steer care, but everyone's own mental health is individualized. And I think, like you said, carrying and picking out people's strengths, like knowing that that's something that is a strength and that you can use and habit stack that. I think that that's pretty important. In terms of medication, improving focus, I think it's difficult to necessarily quantify that. The habits that you routinely get into with your ADHD, is that better, worse, or the same?
I think that that's a good approach to look at things from the positive or the strengths. We're not negating or invalidating any of the difficulties that they're having, or anything that's not going well. But if you're only focusing on the problems with someone, they're not going to feel empowered or like they have anywhere to start. So even if there's just one strength you can pick up, like, oh my gosh, you were both of the same shoes today, as opposed to different shoes, which I have 100% wearing 2 different shoes.
Sure.
But that may seem, and it's not patronizing, it's just like, look, okay, well, I have some place to start. I can draw on this strength of being prepared in this one area, or being really good at managing this one thing. And then from there, you can use that to create new behaviors or new ways of thinking. But if you just focus on all the problems, somebody's just going to feel so defeated.
Yeah. And I also think, even from a medication perspective, like what medication do you know of that doesn't cause a side effect? For instance, some of the stimulants, they'll cause a little bit of anxiety, and people would rather live with that because their focus is better. Yeah. So it's kind of a quality of life thing, and say, hey, is this helping me function better? But I have to deal with this side effect, or I'm a little sweaty, or just various things, or some people are a little jittery sometimes with their medications. I try to mitigate them by using extended release stuff, but even that, it's not a fix for everything. But I always like to evaluate. We have goals of treatment and what they look like, but know that there's no perfect situation or perfect pill for anything, perfect therapy or for whatever. It's just kind of hopefully trying to get closer to someone's achievable goals and then taking it from there. There's hope in people who still haven't found the right treatment for ADHD. And there's always new meds being developed. I think there's actually a combination of stimulants that came out recently. Neurobiofeedback, I think, is one of the things that's out there. People noticing that when they're not as focused, their heart rate's up. So even just looking at your watch and just if it measures your heart rate, just saying that, oh, around these times, my heart rate goes up. I'm not doing physical activity, but I know my attention is this, or if you're breathing, or if you're sweating, or different things that kind of do that. The body and mind are very much connected. And then the last thing I found was about neuromodulatory techniques for stimulating the brain. These are things where delivering different stimulation to different areas of the brain, whether that be through implantable device or whatever, still in the works. But for ADHD therapies, behavioral modification and medications, there's still a lot out there.
And psychotherapy, longer-term psychotherapy, can help with the effects of having ADHD lifelong and feeling like you can't achieve the same things, or you may have just issues with friends, or issues like growing up and not realizing what's going on. And, for women when they're girls, women when they're girls, what does that mean? They have more social problems. And so when I'm working with someone who's 50 and they're looking back at the course of their life and all the different ways that impacted that, that's where a longer term psychodynamic approach is helpful, because it helps them hopefully put it all together and get some aha moments to help, in addition to behavior change, in addition to medication.
Yeah, just I think diagnosis as an adult, when people are like, wow. Some people either take it really well and they're like, all right, great, I have an option to do it. And some people, like you said, have that they look back and think of everything that could have been different.
Absolutely. Absolutely.
Yeah, it's not that that's not appropriate. It's just a matter of working through that and hopefully taking those things and looking for situations in the future or present where they can use them and say, oh, well, I couldn't finish so many tasks when I was younger, but now I'm able to. I guess wrapping it up, long story longer, we are 30-something minutes. We will have to edit, and which will probably take a lot of focus. So we did go over, but I think that this was an issue that was near and dear to both of us.
And we're so happy that you tuned in to our first episode, which we are so excited about.
Yeah, we are receptive to ideas. I think that we are also receptive to new patients or clients. I practice out of Delaware for in-person and telehealth, and New Jersey for telehealth. But we'll include the information on the site for the podcast. Anyone, if you have any questions, you can certainly reach out to us. We'll try and get them. We do have full-time jobs otherwise, so we'll try and get to them as quickly as we can.
And responding to emails, not my strong suit, or text, which I guess is kind of consistent with ADHD.
We're stimulated. We have busy lives. We have a lot of things going on. And again, focus-related issues. So I think we can give ourselves a little bit of kindness and leniency, and that way hopefully our clients can.
Yes, exactly.
So my name is Dominic Marano.
And I'm Katie Brzozowski.
And this was Long Story Longer, and it even went longer. But we hope that gave you some insight, maybe a little more focus into your focus. Bye, and have a good day.